Good morning, everyone. Let's talk about testing. Testing. What does the coronavirus antibody test actually tell you? I think the president is actually taking a different test than the PCR test, and we've heard about the PCR test. But let's talk about these antibody tests. Now that the US is a few months into the new coronavirus outbreak, we're hearing more and more about COVID-19 antibody tests. But that test might not give us the kind of information we're so desperate for. Are these antibody tests, also called serologic tests, actually FDA approved? Who should and shouldn't get one? How accurate are the tests really? And does having access to antibody tests make it easier for things to go back to normal? Unfortunately, there are very few certainties when it comes to antibodies, immunity, and tests themselves. Yeah, and we're not going back to normal. What do antibodies actually do? You're quite familiar with the basic concept of antibodies, perhaps via that perfect episode of the Magic School Bus. But just to review, these are Y shaped proteins your body makes in response to an antigen, which is a pathogen, allergen, or some other substance your body perceives as a threat. Then the antibodies set off a series of biological processes involving other parts of your immune system that clear the antigen from your body and in some cases provide protection from it should you ever meet it again. But as with most biological processes, the reality is much more complicated than that basic story. No shade to Mrs. Frizzle. For one thing, you have different types of antibodies, such as immunoglobulin G or IgG, IgM, IgE. Uh, Kamran Kadhoda, PhD, medical director of the Immunopathology Lab main campus at Cleveland Clinic, tells Self these antibodies appear at different times during an infection and are found in different parts of the body and may do different jobs. For instance, IgG is the antibody we usually associate with the allergic responses rather than viruses or bacteria, and IgA is found in mucosal tissue, just like the respiratory system and intestinal tract. And while IgM is the main antibody responsible for clearing pathology from our pathogen from the body, IgG is the one that usually handles immunity from future infections. Fun fact, IgG can also pass through the placenta and is responsible for giving passive immunity to some pathogens uh, to a developing fetus. Also, the way those antibodies provide protection differs. Sometimes they simply neutralize the pathogen by binding to it so it doesn't bind to your cells, or they might trigger other immune system responses that help the body eliminate the pathogen. But unfortunately, they don't always provide the long lasting immunity we're hoping for. Wow. Well, um, I am somewhat familiar with Truth Cures and the Lyme crime ladies and uh, all of this IgG, IgM. It goes back to fraudulent testing. So I would say these. I don't know how reliable the tests are, but I know uh, the definition they have for the Lyme testing disqualifies a lot of sick people. They're declared insane. Well, not necessarily always insane, but they're told they don't have Lyme disease, and they're often the sickest. The state of the coronavirus antibody test in the U.S. is a little messy. There are many private, state, and university labs working on their own antibody tests right now, which look for antibodies in your blood. But only a few of those tests have been FDA authorized under emergency use authorization, which requires a new process. Tests like these are authorized rather than approved by the FDA. It's an important difference that boils down to the potential for harm, Self explained previously. Yeah, because they, during a so called emergency, then there are exceptions and they are not held responsible for their potential of harm or the fact whether they're really work or not. Because of the extreme importance and urgency of getting antibody testing up and running in the country, the FDA authorized these tests in the interest of getting them to the public more quickly than they would under non-emergency circumstances. If the test is available but hasn't gone through the authorization process, the company is required to notify you that the test hasn't been reviewed by the FDA. But there are considerable flaws when the FDA authorized tests to keep in mind. Experts already made their concerns about the accuracy of those tests clear, leading the FDA to later revise its authorization policy. In particular, a large group of researchers recently tested 12 antibody tests and found that several had somewhat high rates of false positives, meaning you don't have antibodies, but the tests say you do. One test gave false positive results in 15% of cases, and two others gave false positives in 10% of cases, a rate that one of the study authors told CNN was really terrible. Those rates make it difficult to know whether what we're seeing on a large scale and individually is actually true. So if you decide to get an antibody test, it's important to have a thorough conversation with a healthcare provider about what your test results may or may not mean, and do not necessarily change your behavior based on the results of your test. So what can and can't a COVID-19 antibody test tell you? They can probably tell you whether or not you've had the new coronavirus. I would argue that, but I digress. For the most part, an antibody test can tell you with a mostly reasonable amount of certainty whether or not you've had the virus. Specifically, the test will look for the presence of IgG, which appears later or after the infection, as opposed to IgM, which appears earlier in the infection. While the presence of IgM might tell you if someone currently has an infection, in the presence of IgG is more likely to tell you that they've had the infection in the past. If the test is negative, that's probably helpful. Judith Currier, MD, Chief of UCLA Division of Infectious Diseases, tells Self, because it will reinforce your need to continue to use protective measures to keep yourself safe, particularly if you're someone who assumes they've had it already. But it's crucial to remember the possibility for a false positive or negative, and that for whatever your result, should still stick to social distancing, hand washing, mask wearing guidelines. Such horseshit. I just, it's so crazy, people. I mean, the fear and the fact that people are still walking around, it has not amounted to what they have told us it was going to be, this deadly, but people still, anyways. In the case of COVID-19, research so far hasn't completely nailed down the exact timing of the detectable antibody responses. In general, though, Dr. Cad Hoda, I'm probably butchering his name, says IgM is detectable within a week or two after the onset of symptoms, at which point someone usually knows whether or not they've had more severe symptoms. And IgG is, IgG is detectable starting between 14 and 21 days after the onset of symptoms, at which point someone may still actually have symptoms. That means that the mere presence of IgG doesn't necessarily mean they're not infectious or not sick. He says. but if But if, say, you test positive for IgG antibodies a month or more after your infection and no longer have symptoms, that suggests that you probably did have COVID-19 in the past. But I would point you back to learn about the Lyme crime ladies and the truth cures, and Bo Reliosis is on Facebook. Of truth cures, and you'll understand these testing and their accuracy. I'm not that well versed on it. To be clear, they can't tell you whether you're immune to ever getting it again. To be clear, some experts do think that COVID-19 does give you antibodies that provide some level of protection against getting it again, but there's no research yet to prove that having it once provides protection from ever getting it again. Judith Currier, MD, chief of UCLA Division of Infectious Diseases, tells Self, "We don't know yet that having antibody to SARS-CoV-2 protects you," she said. And the CDC agrees. Really. The criminal, demonic convicts. Plus, even if having the antibodies does indicate that you have immunity, we don't know how long that protection lasts. Looking at data we have for previous coronaviruses, including the SARS outbreak in 2002 to 2003. See, they have been building up for this. And here we are 17, 18 years later. And the minor coronaviruses that sweep through every year says any protection that we do get may not last very long. Some studies suggest it might last for about a year. Oh, yes, but giving us an artificial immune system and rewriting our genes, yeah, that will be the answer, because we haven't managed to survive as humans on this planet all this time without having our genetics modified, our messenger RNA CRISPR-Cas9 to bring in whatever it is, the synthetic DNA, which is actually not DNA. It's possible it's GNA, XNA, where it will merge. The unnatural will become the natural, and we will be uploaded to the cloud. While this would still be helpful protection to have and important information to know, especially in the midst, why can't we just live our lives and not walk around in fear? Oh my God, the virus, the virus. Tell me, how did humans last on this planet all this time without these the scientists and politicians uh, to micromanage our lives and monitor our poop, surveil our poop, so that we can find out when we have a pandemic? I mean, come on, people. While this would be still helpful protection to have and important information to know, especially in the midst of a pandemic, the possibility of getting false positives and the fact that this assumption hasn't yet been confirmed in this specific outbreak makes experts in the WHO or the WHO wary of relying on antibody test as a badge of immunity, even in the short term. But I think, like I say, these are the tests that Trump is taking. The idea that having the antibodies is a ticket or a passport that says that you have a shield, that's what makes me nervous, Dr. Currier says, because that means that people will be less likely to follow precautions to reduce their risk for infection. Oh, you might think they might realize that there's not really a problem. As always, the best place to get specific recommendations for your unique case is your own doctor. They can't tell you anything about your personal level of risk for reinfection. Although some experts say it's likely you have, that's funny because, yeah, no, they can't tell you anything. Although your personal level of risk. But the CDC on their own website did show with their own numbers that people wearing masks are getting or have a higher percentage of getting infected than those who don't wear one at all. Although some experts say it's likely you have some limited protection if you've recovered from the virus, that doesn't mean you should walk around like you're totally safe. Oh, no, never do that. That's partly because the actual potential for immunity isn't conclusive yet, but it's also because there's the possibility that different people will develop different levels of protection based on a bunch of different factors that haven't been teased out yet. For instance, results from a recent reprint looking at data from 175 recovered patients in China showed that people who were older had significantly higher concentrations of IgG antibodies in their plasma, i.e., they do not know what they're doing. Though that they claim that they do. The science is not settled. They do not all agree. Conversely, a few people in the study had so few antibodies that the test used in the study couldn't pick them up. Overall, about 30% of the people in the study developed very low levels of antibodies. Well, if you're familiar at all with Mel's work or Lyme disease and even in Patrick Jordan, uh, when it comes to Borrelia shut off the immune system. So just because we don't make antibodies doesn't mean that we're not infected. So again, uh, it works. It starts from fraud. It's all criminal in their fraudulent test. In addition to the assumptions about immunity, there's also the built-in assumption that having IgG antibodies means you're no longer shedding the virus and therefore you're no longer contagious. Although that may be true for some illnesses, uh, Dr. Kadhoda says the timing of this IgG response when patients may still be having symptoms suggests it isn't always the case for new coronavirus. Instead, he says we should keep using the CDC recommended procedure. We know it doesn't work right, but let's keep using it anyways. Involving nasopharyngeal swabs that look for viral DNA to determine whether or not someone is contagious after an infection. Again, if viruses are morphological forms of stressed bacteria, uh, uh, which is according to Mel, uh, then we don't know what they're looking for exactly. They can give us a better idea of how widespread the outbreak was and is. One thing antibody tests are actually useful for is that with enough accuracy, they can give us a better picture of how far the outbreak has spread. We know that the virus has a long incubation period, yeah, yeah, meaning it may be up to 14 days before someone who has the infection actually has symptoms. But if someone doesn't feel sick, or even if they never develop symptoms, they can have the virus and spread it to other people. Oh, yes, those uh, typhoid Marys. We're all typhoid Marys walking around spreading it to everyone else. However, someone who has had no symptoms or only mild symptoms might not ever get COVID-19 tests themselves or ever realize they had the infection, and therefore our estimates of the prevalence of the virus would have missed them. And you know what I find so uh, ridiculous is that, they would, the herd immunity that they used to go on and on about. But now, it's dangerous for us to try to get herd immunity on our own, the natural way. We can't have it. It would be horribly dangerous. We're still waiting for this danger, this threat that they have continually pushed on us. We're all going to die. It has yet to materialize. And, but I mean, it's never ending. So, using antibody tests, we can see who has actually been exposed to the virus, regardless of how severe their illness was or whether or not they ever got a COVID-19 test during their infections. Well, I would argue that they can't tell shit. They can't tell us whether or not it's time to reopen a city. Early on, politicians placed a lot of importance on getting early access to antibody tests, but they're definitely not the singular key to reopening society. Oh no, we couldn't have, even if they had a test and it worked, that wouldn't be enough. They're not reopening society back to normal and safely sending people back to work. Otherwise, how could they bring in their Great Reset? Roll out digital currency and their brave new world in 1984. In New York City, for instance, getting enough antibody tests for the population was first step in determining how widespread the outbreak was. Oh, but now we're going to monitor their poop, so we'll know ahead of time for the outbreak because it'll be in their poop. Although we don't know if we'll use antibody test or PCR, or we'll just make up some stupid test, but it'll give us the authority to lock things down again when we want to because we see it coming. And now that the city is looking to gradually reopen, Governor Andrew Cuomo set up criteria that each county must meet, including things like getting contact tracing up and running and making sure hospitals have enough overflow capacity, consistently seeing a low rate of new infections and making sure healthcare workers have a large enough supply of PP on hand, E on hand. The only way to know for sure if having COVID-19 once it gives you protection is a long-term research, including vaccine trials. Oh yeah, we couldn't do any long-term research. We're on Operation Warp Speed. We've got to get this out right now. So we're going to create an antibody cocktails so that when we take our test, they can prove that it's that you do or don't have whatever it is they want that test to prove. They'll create the fraudulent test first, and then they'll give you these antibodies that will then, supposedly say whether or not you've had this dreaded, deadly disease. Ultimately, the only way to know whether having antibodies to the new coronavirus in your system offers any immunity is to look at long-term studies. What long-term studies would that be? They're rushing through everything. That includes the epidemiological epidemiological. Okay, I'm sorry. I just, wow. Studies of the real world patients who have recovered to see whether or not months later they can be reinfected. For studies like these, data from other countries that dealt with the pandemic before the US will be extremely useful. He says also includes long-term vaccine trials, which are currently underway. There's no long-term. They monitor it enough to get their vaccine through, just like their Lyme vaccine was horrific and actually gave people the Lyme it was claimed to protect them from. Together, these studies would tell us, just like that's what Patrick said in that I read from the transvection. Maybe I should open that again and look at it again. Together, these studies would tell us whether or not reinfection is possible, as whether or not we need a particular level of antibodies in our system to effectively protect us. Again, I have to remind you about the Lyme vaccine, and they ended up pulling it off the market. It was actually giving people Lyme disease. Either way, we should not, and Trump touting he's cured within a couple of days. How would you know that? He could get sick in 2 weeks from now, supposedly, and die. Either way, we should not assume that having had the virus once means you can't get it again. Oh, no, because, just like a cold, you could get it every year. So we would have to sell you a vaccine every year, like the flu vaccine, the toxic flu vaccine. We would have to get you to take one of those every year. Or we could just rewrite your whole system, and then we could just send it through the web, create the poisons and direct them directly into your body. Okay, and we should definitely not be using this assumption as the basis for immunity passports, which the WHO also advises against. Oh no, because we have to wait till we get the vaccines. So should you run out to get an antibody test? Ultimately, if you know or think you've had COVID-19, there may be some usefulness in getting an antibody test, particularly if you want to donate plasma containing the antibodies and you didn't get a positive COVID-19 test to verify your infection. But most of the general public, there should not be any rush to get an antibody test, Dr. Courier says, because whatever result you get doesn't necessarily tell us the things we really want to know, especially with regards to any potential immunity. For those answers, we'll have to keep waiting. Yeah. If we've learned one thing during this pandemic, it's that we have to be clear about what we don't know, Dr. Courier says. We have to acknowledge that we don't know what, because we're learning new things every day. Wow. Okay. I want to go back and look at this. I had come across another link that I almost hate to. Let's see if I can find it. It has all these ads on it, which is going to annoy me, but what is a coronavirus antigen test and how is it different than an antibody test? For months, the U.S. had issues with coronavirus testing, mainly a lack thereof, which was in part inhibited official has well, which has in part inhibited officials' attempts at containing the pandemic. But on May 9th, the U.S. Food and Drug Administration took a step towards making testing more widely available by issuing an emergency approval for an antigen test. Now, okay, so this one is the one I think that Trump is taking, not the antibody test. I apologize. Uh, and I will verify that. But uh, so the Food and Drug Administration took a step towards making testing more widely available by issuing an emergency approval for an antigen test to help identify those with COVID-19, according to a statement released by the agency. The rapid test, officially, yeah, this is it, officially known as the Sophia 2 SARS antigen, created by Quidel Corporation in San Diego, promises to detect fragments of protein found on or within the virus by testing samples collected from nasal cavity using swabs, according to the FDA. The newest COVID-19 test is similar to the rapid strep or flu test and can provide results within 15 minutes, according to Quidel's website. But how does this newer, quicker test compare to other tests currently available in the fight against COVID-19 pandemic? We're back to I hate that word. The plandemic's what I'm going to go, or scamdemic, plandemic. Here's what you need to know. Come on. To understand antigen testing, you have to know what an antigen is. An antigen is a substance recognized by the body's immune system, which can then respond by generating proteins called antibodies that specifically recognize the antigen. A Yale medicine infectious disease doctor and professor of medicine at Yale School of Medicine explains to Health. That means that the point of an antigen test is to detect the presence of a protein, the nucleocapsid protein, which is part of the SARS-CoV-2 virus. That is part of the cause of COVID-19, which they have not even proved that either. They have not taken a purified sample from one person and given it to another person and showed that the infection that was the cause. In that sense, and per FDA statement, an antigen test basically looks for those fragments of antigens within a person's body to see if they're infected with the virus. According to the FDA, antigen tests are collected via nasal cavity swabs, which are then placed into a special solution for virus detection, says Dr. Shaw. The main advantage of antigen tests, per the FDA, is the speed at which they can provide results. Again, Quidel's, or Qdel, I don't know how you say that, website says their antigen test can show results within 15 minutes. Yes, there was a guy that came out and was, I think, in front of the White House in one of those things, and close to the beginning, demonstrating that you open this little Q-tip and you dip this little thing and you get it in 15 minutes. And the man said, "This is not the deep brain biopsy that we were talking about." And I was like, who was talking about deep brain biopsy? But it makes sense the way they stick those, some of those Q-tips way in the back of people's, looks like they're trying to get a biopsy. Okay. Again, Quidel's website says their antigen test can show within 15 minutes. In addition to quick results, antigen tests are also cheaper and easier to use compared to other tests available. Once multiple manufacturers enter the market, the FDA points out, that's when they authorize a fraudulent test and they roll them out. It can potentially scale to test millions of Americans per day. Yeah, but they can't tell someone who has Lyme disease that they actually have Lyme disease. And that, I mean, and the fact that Epstein-Barreliosis AIDS is Lyme disease, is cancer, is all of the different pretty ribbons of the rainbow, ALS, Alzheimer's. That's all one disease. And that's not the pandemic that we're talking about. We're talking about some supposed new novel cold that how are antigen tests different than antibody and PCR? Well, the FDA explained that over the course of the COVID-19 pandemic, it's been issuing use authorization, uh, issuing emergency use authorization, for two different types of testing methods: polymerase chain reaction test, PCR test, and serological or antibody tests. PCR tests, per the FDA, detect the genetic material from the virus or the virus RNA, which can help diagnose an active COVID-19 infection. Yeah, and we know that that's wrong. All you have to do is look into the PCR, the guy who created it, and he says it's not a diagnostic tool. You can find any molecule within any person and blow it up from a tiny minute amount and enlarge it and blow it up. Up until now, the tests used to detect active infections of the virus detect the genetic material of the virus, not proteins. Ellen Foxman, MD, PhD, a Yale medicine laboratory medicine doctor. What? A Yale medicine laboratory medicine doctor in the clinical virology lab at Yale Medicine. Wow, what a freaking name. Ellen Foxman, MD, PhD, a Yale medicine laboratory medicine doctor in the clinical virology lab at Yale Medicine, and an assistant professor of laboratory medicine, tells Heath. These PCR tests are still done through nasal or throat swabs. Well, that they sound awfully smart. Look at all of that at the end of their name. They must be right. They would never tell us bullshit. Antibody test, on the other hand, look for antibodies. I mean, wow. I just, okay. I'm sorry. I'm just a person who has a couple of brain cells left, and I think enough to read and look into things myself. I don't trust someone just because they have a bunch of stuff behind their name. Antibody test, on the other hand, look for antibodies a person's immune system has made in response to the virus that helps doctors determine whether a person has previously been exposed to COVID-19. As of right now, while officials presume that the presence of antibodies means a person will have some immunity to COVID-19, it's unclear how much or how long it lasts. Those antibody tests are done through testing a person's blood, serum, or plasma, while antibodies and antigens are both typically proteins. A positive antigen test reflects active infection, while a positive antibody test reflects recent or past infection. Are there downsides to antigen test? While antigen tests are notably quicker than PCR tests, the downside to increased testing speed may be decreased accuracy. The FDA says antigen tests aren't as specific as PCR tests and may provide false negatives, which then need to be confirmed through a PCR test. Need to do more testing. Luckily, per the FDA, positive results from antigen tests are highly accurate. Oh, isn't that so? They're highly accurate. These tests that Trump's taking, you should be happy to know that, because he's cured now. So you run out and get his antibody treatment. We expect antigen test to be less sensitive than PCR tests because the PCR tests have an amplification step that makes them able to detect very tiny qualities of viral genetic material. I suspect the sensitivity of this new test will be highest in early COVID-19 disease in patients with very high levels of virus. But the false negative rate, especially in later in disease, will be important to know. Dr. Foxman adds that this type of test often has a sensitivity of about around 80 to 85%, which means it's expected to miss 15 to 20% of infections. Antigen tests aren't designed for home use and requires a specialized instrument to be run in certified laboratories, says Dr. Shaw, which means they may still not be as readily available as we hope right away. But overall, any increase in testing is beneficial in the fight against COVID-19. Antigen tests will play a critical role in the fight against COVID-19, and we will continue to offer support and expertise to help with the development of accurate tests and to review and monitor marketed tests to ensure accuracy. Yes, basically, we've authorized these for emergency use. We're not sure if they really work yet. They do somewhat they don't. But we'll continue to monitor it. Well, they need further research, more information. The information in the story is accurate as a press time, blah, blah. Anyways, I just was, thought it was interesting. And I wanted to bring up the difference in the test and I point out the fact that I think President Trump, what test is Trump talking about? A simple test to detect mental impairment. Huh? Oh, he's trying. Wow. Test is Trump. What test is White House using to test for COVID? Trump test negative. So let's see if it tells us. Well, this is from May, it seems like. A rapid coronavirus test that's used to test White House staff could miss infections nearly up to half the time. Now, what test is it? Is what my question is. What is the rapid test? Okay, here. There's fake stream, mainstream. COVID-19 diagnosis of the president, first lady, no, blah, blah, blah. But there's also growing concerns about the test, false negative. Okay. Again, it doesn't tell me what is the the test, the rapid test. No, this could be game changing. Yeah, I want everybody to get what I had, he says. Because he's cured. Let's not forget that. Coronavirus test used by Trump and others at White House may be wrong half the time. Well, tell me, what is the test? Trump touted as maybe game changing. ID Now. It's called the ID Now Molecular COVID Rapid Test. Let's see what it is. Abbott says ID Now at Abbott. Okay, this is from Abbott. The portable rapid molecular ID Now has emerged as a critical part of this arsenal, allowing fast diagnosis with results in 13 minutes or less. A variety of locations. What is going on with rapid? These are still, the ID Now is a rapid or real-time PCR test. So he's still using the PCR test, which literally just amplifies up a tiny, minute piece of something, and they can find whatever they're looking for. It says, okay, Abbott is currently 6 COVID-19 tests. 3 are molecular. They detect the virus during active infection, and 1 is an antigen test, identifying COVID-19 mid-infection as the virus multiplies. And 2 are serology tests there you go. Abbott's got it covered for you. They have 3 different tests. Here's the market right here. They've got all 3 tests with emergency use authorization, Doesn't necessarily have to work like it's supposed to. They got it approved. Test, test, test. Testing, testing, testing. It's key to beating the coronavirus pandemic, according to the World Health Organization. That's why Abbott is leveraging our diagnostics leadership in developing more tests on more platforms to help millions of people around the world for COVID-19. Isn't it a miracle how within just no time, all of these mega companies, big pharma, and uh, from A to Z, all the major mega corporations jumped online. They just, you know, with their essential workers, they got right out there and came up with these things to help save lives. All of our tests have been approved by the the U.S. Food and Drug Administration for emergency use authorization. And among our test types, antigen, molecular, and serology, there are rapid tests that can be performed at the point of care. Think urgent care clinics and doctors' offices, and tests run on large, high volume lab instruments found in hospitals and academic centers, which assess hundreds of samples at a time. Yeah, and that is the state of our fraud. It astonishes me. But there you have it. Uh, the different tests explained. I'll put the links to these articles down below. Thanks for listening, guys.